Hello and welcome to our video on how to work effectively with an interpreter. My name is Marixandra Alvarez and I am a team member of the Applied Learning Team for Alza Su Voz. Alza Su Voz, or translated into English, Speak Out. It's a community-based coalition whose mission is to improve health equity for Spanish speakers and speakers of the indigenous languages in the United States, with a focus on Kansas and the Midwest. As a physician or clinician, you have an important role in creating access to the services that you provide. This takes me to an important topic about what is the role of the interpreter. The basic purpose of an interpreter is to facilitate the communication and understanding between patient and physician or clinician. Interpreters should relay the speaker's message, meaning for meaning. This means that the interpreter is supposed to say everything that's being said exactly as it's being said. Maintaining the register. The register is the level at which a speaker speaks, either formal or informal. Also keeping the tone of the conversation. This means not adding, omitting, or substituting any word or phrase. An example of a formal register is to use the word vomit. A person speaking in an informal register would use the word throwing up. An example would be if a patient is hurting, the interpreter should try to maintain that tone, and the way to do this is to, at the very least, remain with a serious tone, or the contrary of that would be if they were laughing or showing some kind of tone where it's not relevant to the situation. To guide you further, we will break this down into 3 stages. Each stage has one step to follow. So stage number 1 is the pre-encounter. So before the appointment or prior to the session, the interpreter needs a briefing. This is where a short discussion between the interpreter and the physician or clinician prior to starting the appointment, where the interpreter is given a reason for the appointment. The second stage is an encounter. A pre-session is needed and the interpreter needs to do a professional introduction. It is important that the interpreter and provider have a very quick post-session. This means debriefing. This is where the interpreter and provider can have a small discussion on what was done successfully and what needs improvement. Let's dive into briefing. This is our first stage and our first step, where the physician or clinician should share basic information to the interpreter, like demographic information or present problem. So what should be included in briefing? Firstly, the nature of the visit. Like, what is the main purpose for that visit? Will any special terms be used? The provider or clinician should share what the diagnostic is and make sure that the interpreter understands that diagnostic. It is your responsibility as a physician or clinician to make sure that you assist the interpreter in understanding what they're going to talk about. This is the time that you will take to prepare the interpreter, either by explaining or by providing them with any documents that will prepare them for such visit. Lastly, but not least important, is there anything that they should be aware of? Like, is there going to be a procedure done, or is there going to be an exam done, so that the interpreter knows how to best prepare when that moment comes. Our next topic will be positioning. One effective way to establish the connection between patient and provider or clinician is for the interpreter to position itself in a way that they promote direct communication. Many untrained interpreters will position themselves between the patient and doctor and communicate directly with both. A trained interpreter will stand beside the patient, slightly behind the patient, in what we call a broken triangle. This encourages the participants of the conversation to look directly at one another and speak directly to one another. Now, there is a certain level of flexibility in the positioning, and that the interpreter needs to use their own judgment depending on the specific context and/or shape or setup of the room. Another effective way to work with an interpreter is to use your first-person voice. What do I mean by this? Instead of looking to the interpreter and saying something like, "Can you ask Miss X how is she feeling today?" I encourage you to look straight to the patient and ask directly, "How are you feeling today, Miss X?" This will promote direct communication. Please remember that you are also responsible in promoting direct communication. Next, we'll talk about introduction. What is an introduction and when does this happen? An introduction is a quick way to outline the interpreter's role and the expectations of the interpreter. An introduction should be used before the start of the appointment with both the patient and the provider or clinician. This is called the pre-session. This professional introduction should not exceed any more than 30 seconds. This consists of 6 primary pieces. So number 1 is the interpreter should identify themselves with their name and language of service. Number 2, confidentiality. The interpreter should state that anything being said will not be shared outside of the room. Number 3, accuracy and transparency. The interpreter should relay everything that is spoken exactly as it is said. Number 4, direct communication. The interpreter will be speaking in the first-person voice, and the patient and physician or clinician should address each other directly. Number 5, pauses. Both patient and physician or clinician should stop frequently to allow the interpreter to relay accurate information. Number 6, clarification. The interpreter may need to intervene if any concept is unclear or if there is a miscommunication. Let me give you a quick example of what an introduction should look like with the physician or clinician. Remember that this is the same introduction that should be given to the patient in their language. Hi, my name is Marixandra Alvarez. I am with Alce Su Voz. I will be your Spanish interpreter. Everything we will discuss will be confidential. I will repeat everything that you say exactly as it is said, including side conversation. Please speak directly to the patient. Please remember to pause frequently so I can interpret accurately. If there's a misunderstanding, I will intervene to clarify. Now I can give you some additional tips on working with an interpreter. The very first tip prior to using an interpreter is to ask the patient if they need an interpreter. In what language does he or she speak? Please keep in mind that it's very often that the patient may say that they do speak Spanish, but it's very probable that Spanish is not their first language, as it is common to assume that speakers of indigenous languages are proficient in Spanish. They may need a speaker of that language. Never use children to interpret, as it is irresponsible to put a child in an interpreter role that requires training. Only use trained bilingual employees if no other interpreter is available. If the patient insists on using his or her own interpreter, there are steps that should be taken to ensure that the patient understands the risk. It is always best to use an interpreter that has had some training. Remember, it is not enough to be bilingual. Speak slowly rather than loudly. Don't talk too long without letting the interpreter speak, as you will lose the accuracy of the interpretation. It is recommended to do short segments of 1 to 2 sentences. Please have an awareness of conceptual equivalence. Interpreters may have to paint a picture of the terms or words that are being used. Some physicians or clinicians may pull up their laptop to pull up a picture to show to the patient. Be aware of cultural misunderstandings or conflicts. A trained interpreter is trained to bring those up when they are present. Please use the teach-back method. Please have the patient repeat back what you just said. It is the physician or clinician's responsibility to restate or clarify any information. Please refrain from asking an interpreter to sight translate. Sight translation is when an interpreter takes a document and they have to read it out loud. Please refrain from sight translation, as sometimes it can be very complex. The physician or clinician may go over those documents and use the interpreter in that room. The physician or clinician should explain what those documents contain, and the interpreter can jump into the role and translate verbally. Please avoid using Google Translate. A Pennsylvania judge ruled that Google Translate does not make an adequate method for soliciting consent, as it has an alarming capacity of causing communication errors. And with all that being said, thank you for watching, and if you have additional questions, please feel free to reach out.